Hi, my name is Mike Clark. I'm the Director of Research and Education for clinics in Austin, Texas. They're called Natural BioHealth. We have 4 clinics, one in Austin, one in San Antonio, one in College Station, and also we have one in Odessa, Texas. These 4 clinics have been operating for approximately 14 years now. We basically specialize in bioidentical hormones, functional medicine, and medical weight loss. More and more men at a younger age have low testosterone. If you're over the age of 30, we pretty much say we know you have low testosterone nowadays. There's lots of reasons, but it's just a given. So when we do a blood test, every one of them is going to be low on free testosterone. In 14 years, we still haven't seen an exception. Testosterone protects them against heart disease, prostate cancer, depression, type 2 diabetes, amyloid plaque formation in the brain. Women, of course, if they're postmenopausal, they're typically going to have no hormones or very small amounts of them. They may feel okay and they say, well, I'm feeling fine. But if you don't have the hormones, you don't get the protection against heart disease for the women with estrogen. Progesterone pretty much protects you against all forms of breast cancer. Testosterone protects you against breast cancer. These are all kind of things that sometimes the ladies don't realize, and neither do the men. They kind of want to feel better, and they may want to address their specific symptoms, but they don't really understand all the health benefits that come from having optimal hormone levels. What we hear all the time from a diet and nutrition point of view is, wow, I'm exercising really good, very regular, I'm eating good, I'm following all the rules about how you're supposed to eat. How come I'm still not feeling great? How come I'm not building muscle like I used to? How come I'm still tired? Well, diet and exercise is extremely important to health. It doesn't overcome the needs for hormones. Weight loss is critical and it's directly related to hormones. After 14 years of being in practice in this area, we've found that almost all weight loss problems are somehow related to hormones. Again, men typically going to have more belly fat, you're not going to gain muscle, and that can apply to women too. They have low testosterone. If you don't have your hormones balanced and optimized, you're probably going to have a weight problem. One of the things we see in women, the most common, is estrogen dominant. Now, what that typically means in the lady before they're postmenopausal is they have high estrogen and low progesterone. So the body tends to have a signal that it wants to store fat. So again, no matter what they do, they store fat. We also find, again, natural supplementation is very important. We spend a lot of time on sleep, on constipation, and we spend a lot of time on stress. We test everybody just about now for what we call a 12-hour cortisol test, and we are not finding anybody that's not stressed. That's men and women. So the hormones don't work as well if you're stressed, your diet and exercise don't work as well, you don't feel good. So we're addressing stress a lot. We're also adding chelation to our practice. We find chelation to be an incredible benefit to patients. And we're also adding things like thermography, which is to examine the lady's breast without doing mammograms. Mammograms, of course, have radiation and they have a lot of other problems. Thermogram will identify things much earlier and without all the risks that mammograms have. One other thing I'd like to mention is brain fitness. We tend to ignore the brain. The brain is the most important organ in our body. It uses about 20 to 30% of our energy. So we're developing a whole new therapy on brain fitness. Again, it's all related, the gut, the hormones, the exercise, the healthy eating. It's all related to the brain. But the brain is something we're starting to look at from day one and not waiting until an afterthought when someone maybe has cognitive problems, lack of memory, dementia in more severe cases. So brain fitness is a critical part of our practice. If you'd like to know more about our practice, you can go to our website at mbhlifetimehealth.com.